I want to welcome Dr. Lowell Kabnick, who is the Chancellor for the Vein and Lymphatic University and also prior president for the American Venous Forum. Thank you for agreeing to do this podcast on the upcoming Venous session for VEITH 2024. So, Dr. Kabnick, this session has had a long history. Can you just talk a little bit about where this session started from?
So the session started many years ago, and it was interesting. The first year that we did it, there was a small room downstairs in the basement of the Hilton. I think it was either the Hilton or the Sheraton. I think it was the Sheraton at the time, and it had about 50 people in that room. The next year, we had the same room, but there were 250 people, and Dr. VEITH made a quick adjustment and put us in another room and it filled up. And then ever since that time, we've been really growing. So it's really a big meeting. We start on a Wednesday, and this year we're going to do controversies in venous disease management. And for example, will be saphenous ablation alone is adequate to relieve symptoms or not. Phlebectomy alone is adequate or not. Nibbles need to be aggressively stented or not. Most iliofemorals post-thrombotic cases need stenting. Most iliofemorals post-thrombotic do not need stenting. All retrievable IVC filters need to be removed, etc. So these will be controversial by experts in the field that may take an opposite opinion as to what they believe in, which makes it always interesting. And that's Wednesday morning. Wednesday afternoon, we go to a workshop, and that workshop has been going on for several years. It's divided into 3 parts, and it typically goes from 1 to 6. The first part is video cases with discussions by experts and questions from the audience. The second part is a hands-on opportunity with devices from the industry. And the third part is rapid-fire cases, basically cases that you would expect to approach in your life with answers and sometimes controversy, as some of the experts may give different opinions, and then there'll be questions by the audience as well to figure out what's going on. And then the interesting thing that's going to happen then is on Thursday, which is our plenary session, and it takes all day Thursday and all day Friday, and there are VEITH-style rapid-fire discussions, presentations, and they're 5 minutes apiece. So you can think that there are over 200 presentations. And so and then after each session, there is a question and answer period. So it's really kind of informative. And you can imagine with 200 lectures, we cover just about everything. So on Thursday morning, we cover superficial venous disease, medical necessary and cosmetic, lymphedema, lipedema, venous edema, and venous wounds. And some of the things that we're looking at in terms of highlights are genetics and venous disease, a comparison of the revised SVS, AVF, ASVL, all of the different societies in terms of clinical practice guidelines and what's different amongst them. So that's kind of an interesting soliloquy. Summary of important venous and lymphatic articles by the International Angiology editor. Summary of important venous and lymphatic articles in the Journal of Phlebology, the editor, and summary of important venous and lymphatic articles in the Journal of Vascular Surgery, Venous and Lymphatic Disorders. So we have 3 major venous journals that are being summarized in major articles. And then we can look at compression. Does it work? What data do you have? Non-compounded polydocanal, 1%. an endovenous microform, varithena, or thermal ablation, a network meta-analysis. Thermal versus non-thermal. Is it time to stop the fire?
Sounds great.
Oh,
But the collection you have is enviable. I mean, you cover everything with speakers from all around
I'm
the
not
world.
even near talking about it, but let's head off to that one. One of the things that we talk about in this part is the venous edema, the lipedema, the lymphedema, some of the ways to treat it, some of the ways to make diagnosis. And then we're talking about compression, oxygen, unification, which is something new in a venous space. And so that pretty much goes from 7 a.m. to 7 p.m. with an hour break for lunch. So let's move on to Friday. Just when you thought we were done, we're going to talk about deep venous disease, chronic obstruction, acute obstruction, vena cava issues. So some of the highlights of this will be NIVL management, highlights from VIVA, AVF, AVLS, a consensus statement, indications, technical aspects, and outcomes of stent placement in chronic iliofemoral venous obstruction, open surgical and endovascular treatment of the superior vena cava syndrome, IVC reconstructions, hemodynamic consequences after venous stenting, and in vitro assessment. So throughout both Thursday and Friday, there will be venous pathophysiology and what it does to, when we correct it, what happens to it. Tips and tricks for optimal management of primary and secondary IVC tumors. DC filter retrieval, basic and advanced. Which DOAC for what disease? Review ongoing trials. I can go on. Will the best trial answer the question on iliac stenting? Venous registries, 3 and 4 year reports, and ultrasound imaging and computational fluid dynamics, protocol to assess hemodynamics in iliac vein compression syndrome. So it's pretty extensive, and between Wednesday through Friday, we've covered it all.
Sounds really exciting. So who should attend this meeting?
So it's kind of interesting that you ask. So we have something for everybody. We have people that are interested in superficial venous disease from a medical standpoint. We have people that could be interested in superficial venous disease that are in the aesthetic part, because there's a fair amount of aesthetics on Thursday. On Friday, it's the venous interventionalists, those that are committed to venous intervention on a deep scale. And people really should understand what's out there. You know, if you don't practice superficial venous disease, deep venous disease, you should know what we have to offer.
Okay, that sounds great. So you created over the last couple of decades a really exciting meeting. You have speakers from all around the world. You're covering all sorts of topics from A to Z. I think you might have one of the largest collection of speakers and talks from any venous meeting, quite frankly. It's very comprehensive. They have some dynamite speakers, great questions, great debates worldwide. Where do you see the meeting going in the future? Because it seems to be getting bigger and better every year.
This is a tough act to follow. And every year we say, how are we going to do it? And every year we come up with other topics, because as you know, in medicine, everything progresses. And now that we're going to go into the period of artificial intelligence, I suspect we're going to see a fair amount of change quickly. So I'm excited to introduce what's going to happen in the future.
Sounds great. Looking forward to the meeting in New York City at the VEITH 2024 meeting.
It's going to be very dynamic. And you know what's really nice is that the speakers are all approachable. You can side curb them at any time. We're always there. I mean, it's all about give back and teaching. And that's who we really kind of invite the people that really want to teach, that want to extend themselves, that give you their recipe, or if they're talking about their research, they'll tell you what's going on. But more importantly, they'll also tell you what other people think as well. So they're fairly descriptive, they're fairly to the point, and more importantly, honest.
I could not agree more. I mean, I've been able to approach so many speakers there who I've read about, learned about, read their chapters, and they're just so approachable when I have a question. It's really, really a great camaraderie. And also the networking is just a great potential there. Again, the meetings from November 20th to the 22nd in November in New York City in 2024. Looking forward to it. Thank you.
I do have one more comment.
Yes.
In the Frank VEITH style, because there's so much information, you might miss something, or you're talking, it's 5 minutes, but you can actually sign on and go to their site where they will play back every talk. So they're indexed. So after the meeting, sometime usually in December, they'll roll this out, and for a nominal fee, or sometimes no fee if you've attended, it's amazing because you can always go back if you miss something or you really want to learn it, it's there. And that's brilliant.
It really is, because you can't cover everything. You can't listen to everything. And if you have the opportunity to look at it at home, it's really a great tool, and it helps reinforce what people are talking about.
So we hope to see you there. It'll be nice, and say hello, and I'd be happy to help.
Thank you.